Hello, I'm Suresh Gunasekaran, CEO of University of Iowa Hospitals and Clinics and Associate Vice President for UI Healthcare. We are delighted to again be part of the Iowa Ideas Conference. Now in its fourth year, Iowa Ideas provides a unique opportunity to bring together a wide variety of different voices, perspectives, and thoughts to create a better future for us all. 2020 is a year that none of us could have predicted and has given us unprecedented healthcare challenges. In some ways, these challenges have made us better at delivering care, but it has also further highlighted the serious gaps some Iowans face in receiving adequate healthcare services. Let's start the discussions here and follow through to deliver better health for all. Thank you for being a part of this important discussion.
My name is Marissa Payne. I'm the Gazette Cedar Rapids government reporter, and welcome to all of you on this panel on mental health on the healthcare track. Today we'll be talking about how much the year 2020 has really worn on people's mental health. That all the elements of this year are a recipe for a dramatic increase in mental health issues across the state between quarantine fatigue, political stressors, shifts in family and social dynamics, economic uncertainty. So with all that's going on, how might people differentiate between expected bouts of anxiety versus high-risk long-term impact mental health issues? And we'll also touch on how these issues could exacerbate existing systemic problems within Iowa's mental health care system. As a reminder, attendees are welcome to join in the discussion by using the Whova chat feature. Please feel free to pop in with questions at any time, and I'll incorporate those into the questions I'm asking our panelists. So let's welcome our three panelists. We have with us here today Peggy Huppert, the Executive Director of the National Alliance on Mental Illness, Jacob Christensen, the founder of Covenant Family Solutions based in Marion, and Jennifer Jones, the Director of the Change of Mind Institute with the Alliance for Strong Families and Communities. So thanks to you three for joining us today. Can you tell us just a little bit more about yourselves and your organizations and your backgrounds with mental health? We can start with Peggy.
Well, thank you, Marissa, and thanks for having me. It's my pleasure to be part of this really important discussion. A lot of you are familiar with NAMI, National Alliance on Mental Illness. We're the nation's largest and oldest grassroots organization addressing issues around mental health. We have chapters in all 50 states. Over 600 local affiliates. I'm the executive director for Iowa, and we have now 15 local affiliates in the state, covering, I think we're up to 52 counties. So what we do is training and education with people who have lived experience, whether that's people with a mental health diagnosis or loved ones. And we offer classes, support groups, presentations to educate. We have actually 8 signature programs that we're doing in Iowa. So I hope to have a chance to talk more about that later because it's a really important piece of a mental health continuum of services, but one that's not very well understood by a lot of people. So thank you.
You want me to go next?
Yeah.
Sure thing. So my name is Jacob Christensen. I have a PhD in marriage and family therapy, and I've been working in the field of mental health for about 20 years now. For several years, I taught graduate students how to be a therapist, and then about 8 years ago, I founded Covenant Family Solutions. I did that because in this area there was an identified need, and there wasn't enough people to be able to help with the demand that was rising for mental health services. So Covenant Family Solutions is the leading provider of behavioral and mental healthcare services in Eastern Iowa. We do have different services. We offer just regular therapy that most people are familiar with. We also have medication management for individuals, couples, and families. And then we offer behavioral health intervention services, which is more of a skills training type of program. The emphasis that we have is on strengthening families by helping clients experience fulfillment in their lives. We really want people to take what they know and to strengthen their communities and their families as well. We are based in Marion, as was said, but we do have additional offices in Cedar Rapids, Coralville, and Cedar Falls. And with telehealth, the way that that's been going over the last 8 months or so, we've extended our reach out even quite a bit farther than that. So that's kind of our story.
Great. I guess I'm up next. So thank you, Marissa, and for certainly the introduction and for including me on the panel to discuss mental health. As Peggy said, a very important topic. This is my first Iowa Ideas event, or Jacob, sorry. As Marissa mentioned, my name is Jennifer Jones, and I'm the director of the Change in Mind Institute at the Alliance for Strong Families and Communities. I also serve as the co-director of our Safety and Resilience Impact Area, where we focus a lot of our work on preventing early childhood adversity and promoting positive childhood experiences with an attention towards the child welfare system. The Alliance for Strong Families and Communities works to translate knowledge into best practices. We incubate new research and policies to generate solutions to some of our most complex issues that face our families and communities. Certainly, a lot of them we're experiencing all at once in this time. But our vision is simple. We want a healthy and equitable society for all. Our strategic action network of thousands of social sector professionals work with millions of people every day, just like all of you do, to help build, maintain, and restore physical, emotional, social, and economic well-being. And over the past 5 years, as the director of the Change Agents across North America, I'm really looking at how we infuse, align, and accelerate the latest advances in brain science research into organizational culture and policies and practices. And we also look at and have been focused on how we change the way our systems interact and intersect with children, youth, families, and communities, given what we now know about brain science research. I've also been involved in national research, looking at the impact of positive childhood experiences and the role they play on physical and mental health outcomes. We had some research published last fall in JAMA Pediatrics and several. So I am very excited to be here, and I really look forward to our conversation over the next hour.
Yeah, thanks again to all of you for being here with us today. So, kind of before we dive into the whole system, can we kind of establish for people, what we know about an individual's response to stress and how that's shaped through their childhood experiences, as well as how we see mental health issues manifest in children versus adults?
Marissa, do you just want us to go, or are you gonna?
Yeah, whoever wants to start that off.
Okay, I can certainly start. So many of you are probably familiar with the Adverse Childhood Experiences, or ACEs study. It was conducted in 1995 through 97 and was led by Dr. Vincent Folletti at Kaiser Permanente in San Diego and Dr. Rob Anda at the Centers for Disease Control and Prevention. More than 17,000 individuals, the largest study of its kind to date, participated. And they did a physical examination of all the individuals and a survey about child abuse and neglect in particular, as well as other adverse experiences. And then the information from that survey, that confidential survey, was combined with the results of their physical exam, and it formed the baseline data for what we now know as the ACEs study. But what it found was that ACEs are common, they're highly interrelated, they're cumulative, and they're certainly strongly correlated with poor physical health and well-being outcomes. In fact, we know decades of research that show the more ACEs you have, your risk for just about every social, behavioral health, and physical health problem. So in fact, compared with people with 0 ACEs, those with 4 or more ACEs are 12.2 times more likely to have attempted suicide and 5.5 times more likely to miss at least 14 days of work in a month due to mental illness. And according to CDC, we also know that preventing ACEs could actually reduce the number of adults with depression by as much as 44%. And in fact, recently, there are a number of researchers and advocates that have been calling for COVID to be considered an ACE, given the tremendous impact that it has and has been having and will continue to have on lifelong physical and mental health outcomes. There's also some research showing that individuals with ACEs are much more challenged by the social isolation and the related stressors of the state of the world today, in particular COVID. So we'll continue to see a lot more research coming out in the months and the years following the pandemic. But I want to also say it's really important that we acknowledge the role that positive childhood experiences play, and certainly how significant, if not more, they are to the health and well-being of kids and youth. So our research that I've been running and participating in found that positive childhood experiences, like being able to talk about your feelings and having family stand by you in difficult times, feeling a sense of belonging in high school, or feeling protected by an adult, really protects against depression and helps mitigate ACEs directly. So we found that nearly 60% of individuals with 4 or more ACEs and only 0 to 2 positive childhood experiences reported depression or poor mental health, in comparison to 20% with 4 or more ACEs and 6 to 7 positive childhood experiences. So what we're seeing is that the more positive childhood experiences you have, even despite very high ACE scores, the less likely you are to actually experience depression or poor mental health. So positive childhood experiences make it much easier to overcome the effects that we know come from negative early childhood adversity. So I'll just end with the earlier we nurture children's well-being and we provide more childhood experiences, the more likely they will have the love and the support they needed for going into adulthood and for experiencing lifelong health and happiness.
Yeah, I think one thing I would build off of that with is that just looking at it even from like a therapy perspective, when you get adults that have a really hard time dealing with stress, and they struggle to moderate their emotional regulation and all these things, a lot of times they look at themselves and they're very judgmental towards themselves and don't really recognize that, you know, our temperament as a child, our experiences, they kind of program us or hardwire us for how to deal with stress. And so I try to tell people a lot of times, like, just relax a little bit and realize that it's not that you're weak or horrible or terrible. Like, some of this stuff is just kind of baked in. And so it's not something you should feel bad about or feel like you're deficient for. It's just something that we try to build within a person, is to be able to regulate and manage their stress reaction better. And so I know that there's obviously like a lot of effect that comes from the experiences that we have, and we shouldn't hold ourselves completely accountable for all the things that we can or can't do because of that. And that recognition needs to grow about how those experiences shape our lives and our reactions to different experiences that we have.
Wow, those are great points. And I just want to say, as an advocate and a family member, because I'm not a therapist, I'm not a clinician, I'm not a researcher, but I am a family member and an advocate, that those all ring very true for me. And we know that ACEs, that childhood stress, childhood trauma has lifelong effects. And I can give a personal example, and my husband talks about this. It was a real revelation for him to learn that he scored 7 on the ACEs spectrum, which is high. And he suffers with a variety of mental health conditions. And some of that is directly relatable to his childhood trauma, and then some trauma that he experienced later in life. But what he lacks in now as an adult is resiliency, the ability, as Jacob referenced, the ability to handle stress, or we all experience adverse events in our life. We've had a disproportionate amount of them this year, for sure. But people who have experienced the childhood trauma have a harder time dealing with those and bouncing back. It's it's tougher. The other thing I want to point out is that unfortunately, children today, children and youth, are experiencing their own trauma as a result of the pandemic, of not being able to go to school, not being able to be with their friends, to play sports, to have their prom, to with very young children. Their ability to learn is tied to parallel play and being around kids their own age. And they've been isolated. They're fearful, they're anxious. There have been economic consequences of the pandemic. Parents have lost jobs. They've lost grandparents and other relatives to the disease. And we really have no idea of the long-term consequences of this trauma, but I can assure you, we'll be seeing it for years to come.
I do hope that one thing that comes out of this whole thing is an increased degree of compassion, though, for people. That is something that, as we recognize that the impact that all of this is having on people, that we should expect that there will be more difficulties, and instead of again seeing that as a problem that's insurmountable, it should be something that, with a little bit of compassion, understanding, can actually help us to be able to overcome the challenges that will come with it. But I very much agree. Like we are in this for the long haul. Like the effects. You could have a cure tomorrow and everything would be wonderful in the health part of it. And the mental health impact is going to just be years and years in the making.
I agree.
Thanks. Thanks for those. So to kind of, segue into discussing Iowa's mental health care system, can you perhaps, Peggy and Jacob, talk about how before the pandemic kind of lay the groundwork for people, the role of providers in Iowa's mental health care system, and kind of, run through some of the issues with it, that people were already trying to navigate before the pandemic.
Yeah, I'd be happy to do that. NAMI is very involved in advocacy. We have a strong presence at the state legislature, as well as a federal involvement. And we've been hard at work trying to improve the mental health system in Iowa for a while now, and actually have had some pretty good policy results in the last few years. The complex needs legislation that passed 2 years ago, it puts in place a lot of new programs for people with complex mental health needs that will be coming online over the next few years, including access centers, intensive behavioral group homes, treatment ACT teams, some evidence-based practices that we know work, that we need to, and are being done in sometimes limited settings. We need to expand them and get them all across the state. We've also we've started a children's mental health system, which previously we were one of 3 states that had no children's mental health system. And it's been talked about for years, and we finally were able to get legislation to establish a children's mental health system. The mental health and disability regions in our state, the 14 regions, which are funded through the property tax levy by the counties, are responsible for mental health and disability services. And they're also responsible for implementing the new children's system. And I serve on the Children's Behavioral Health Board. I was appointed by the governor. We're charged with making sure this happens. The pandemic certainly was a glitch. It certainly caused a pause in some work, but we have every intention of making sure that it moves forward. Unfortunately, Iowa is quite far behind in a lot of measures on mental health, and we have quite a lot of ground to make up.
Yeah, I would say that support the same thing, that we underwent a huge transition a number of years ago, and that transition just continues, and it's a major undertaking, and there's a lot of work to be done left. One thing I would comment on is just how amazing of a job the providers here in Iowa did back in February, March, and April. I remember about 3 or 4 years ago talking to somebody and saying, like, yeah, within the next 20 years or so, pretty much everybody's going to do telehealth, and they're going to know how to do that, and they're going to be able to be proficient in that. It's going to be something they're going to have to do. And little did I know, like 2 or 3 years later, we would have a overnight shift from in-person mental health to telehealth. And the providers that I've seen, who are dealing with their own struggles, their own losses, their own problems, just overnight completely changed the way that they deliver services. And it was amazing to me and heartwarming at the same time, just to see how flexible and how able we were to overcome that challenge, to be able to meet the needs of people during a time when, I mean, frankly, we're as a nation, as a country, as a county, we're falling apart. And to be able to make that change and adapt so quickly was just amazing to me. And I think there's a lot to be said within the mental health system of simplifying that process. It went very simple overnight because everybody kind of cleared all the hurdles. But of course, they'll start putting those hurdles back. And so there's plenty to navigate and figure out with that. But I do think it's worth acknowledging that some people did some pretty amazing things and engaged in a Herculean effort to make sure that we can meet the mental health needs of the state.
And I agree with that, Jacob. One of the silver linings of the pandemic has been the explosion of telehealth. We've been working on this for several years, trying to expand telehealth, trying to remove barriers, trying to achieve parity in funding, which was a major barrier, but also technological barriers for people to be able to actually do it from their own homes, which previously they really couldn't, allowing the audio-only option for therapy sessions. All that really changed almost overnight, and providers really stepped up. And that has been the difference in a lot of Iowans being able to get care, and especially behavioral health care, because we have a critical lack of providers, a shortage. We have too few of almost everything. So opening it up and making it more accessible has been key. And there's a very strong coalition of patient advocacy groups like NAMI, as well as providers, that are working to make these changes permanent, because we think they need to be.
Yeah, I would just add too here, obviously I'm not directly involved in the work in the state of Iowa, but I think we're seeing what Peggy having to step up. I think one of the silver linings of the pandemic and the economic recession, and certainly the racial unrest that we're experiencing in our country, is the fact that folks really had to think innovatively on how we do things differently. And I think we're going to see that. I know we're exploring some things at the national level as well, and some of the regulations and administrative rules that we've either had to been halted or temporarily put on hold because of the pandemic. And Peggy, as you said, how do we make sure the things that are going well and the things that we are doing that are helping us help people better, that they become permanent fixes. And obviously you're experiencing that in Iowa, and we're experiencing that certainly all over the country with organizations that we work with. I want to just take a moment too to call out an amazing organization and resource in Iowa that I've worked with over the years called Iowa ACEs 360. Peggy, you're probably familiar with them. But they provide resources and certainly individuals that are working tirelessly, really, to prevent ACEs and to mitigate what we know are the negative effects associated with early childhood adversity. And so they're really working to, I think, if you go visit their website, you'll see their vision is working to create compassionate communities that support all Iowans in lifelong healthy development. So I just encourage folks to, if you aren't connected with them, certainly reach out. They've been doing some great work over the past probably 10 or so years that I've been involved in this work. So just wanted to make sure folks were aware of them if you weren't already.
Yeah, thank you for your broader perspective, Jennifer. We had an audience question. This audience member was curious about, why are we continuing to see facilities in Iowa, closed down or a loss in beds for mental health care while the state ranks, pretty much dead last for mental health care.
Well, that is a pretty well-known statistic that Iowa ranks. We do rank dead last in the number of public inpatient beds. We have only 64. The next lowest state is New Hampshire with about 300. So we are way, way far behind. That was a conscious decision. Former Governor Branstad closed down 2 of the facilities. And it was a cost containment. It was stated that it was to provide better care in communities, but unfortunately, the care that was being provided at those institutions is not generally available in communities. So, but it's also been part of a national movement toward deinstitutionalization. Hundreds of thousands of beds in facilities like the mental health institutes here in Iowa have been closed over the last 30, 40 years. And unfortunately, the main result of that has been a huge spike in homelessness, because 90% of chronically homeless people have a serious mental health diagnosis, and incarceration. About 50% of the people in Iowa jails right now, 40% of male prisoners in the state prison system, and 85% of females at Mitchellville have at least one serious mental health condition. So that has been the result, and we have not developed the community-based services in response that we should have and that we need to. So Iowa's not alone in that challenge, but we unfortunately are behind.
Yeah, and I don't dispute any of those facts. By all measures, our public mental health system is inadequate. Is woefully inadequate. One silver lining, or one piece that I think is worth highlighting that hopefully provides at least some value to the community is that the private part of it has increased a lot. Just as an example, like Covenant Family Solutions, we've hired 40 providers over the last 8 years that did not provide services at all. I had never provided services in Iowa before we brought them on and had them begin to work with us. So while we have a lot of work to do in the public part of it, we have seen some increase in availability through the private side of things, which again is by no means a solution, but hopefully mitigates at least a little bit of the damage that can be done through decreasing and closing the different pieces of the public health system.
And I agree with you, Jacob, but I'll push back a little bit and say that really part of the problem is the people who tend to fall into homelessness or become incarcerated are those with serious mental illness, meaning, I'll define that as schizophrenia, bipolar disorder, schizoaffective disorder. It's a relatively small percentage of our population, but they make up the people who continue to cycle through jails and homeless shelters and eat up a lot of resources. The city of Iowa City did a study a few years back. They followed 8 homeless men in Iowa City over a period of 4 years and found that all told, over $1 million was spent on their care. And at the end of the day, after 4 years of cycling in and out of hospitals, shelters, jail, they were all still on urine-stained mattresses under a bridge. So that really, a lot more people are getting access to mental health. And there's been a rise in anxiety and depression, and I think people with those conditions are getting more help, and more help is available. But the most seriously ill, the ones who hear voices, the ones who a lot of people consider to be scary, are still, for the most part, not getting the help they need.
Yeah, I don't think we have any disagreement with that.
Yeah, and then of course in 2020, there's, as I alluded to earlier, there's so much wearing on people between the social unrest and the economic and political uncertainty and changes to everyone's personal lives. So how do some of these long-term stressors differ from, expected bouts of stress that people may be more accustomed to handling?
Marissa, I'm happy to start here. So I want to actually start here with these certainly are not normal times. Obviously, we all know that. We're all living this. The pandemic has certainly affected the emotional state of so many of us, including those who usually don't worry or haven't worried about their mental health. And so for some people, for the first time in their lives, they're actually dealing with depression and anxiety as a result of COVID. In fact, I was just reading a recent article published in JAMA, and there's evidence that a second wave, quote, second wave linked to the rising rates of mental health and substance use disorders is going to occur during COVID. I think we all know this. We're all expecting it. It's likely to overwhelm our already frayed mental health system and certainly lead to increased deaths from suicide and drug overdoses. And it's important to note that it will have a disproportionate effect on the same groups that COVID has. So Black and Hispanic people, older adults, people with low incomes, and healthcare workers, certainly. But I also want to just say, while all of us strive to be resilient and well, we know that the physical and psychological impacts of stress, of constant stress, levels that can become toxic to the body through too much cortisol production. Brain science has shown us that years of the stress can contribute to negative physical and behavioral health outcomes. And I mentioned that earlier with what we know from the ACE study. I also want to just mention that there's 3 kinds of stress that our body responds, the way our body's stress response works, right? So there's positive, there's tolerable, and then there's certainly toxic. So positive stress, as we know, is sort of a normal and an essential part of healthy development. It's characterized by sort of brief increases in heart rate. And so some of the situations that might trigger that response are speaking at an event or participating in a panel like this, or going to a job interview. And then tolerable stress activates the body's fight, flight, or response system. And this can include the loss of a loved one, a global pandemic, a natural disaster. But we know that if this stress is time limited and it's buffered by what we know about sort of strong, positive, and loving relationships, that it's easier to adapt and recover from what the potential damaging effects can be. But the more damaging stress response we know about is toxic stress, and that certainly occurs when a child experiences frequent or prolonged adversity like child abuse or neglect, and it happens over a period of time without the adequate support or love or positive relationship from a caring adult. And this kind of stress can actually disrupt brain architecture, and it increases the risk for chronic disease. And it can have long-lasting and damaging effects. But I also want to say that we also know that there are a number of factors that really help children cope and adults in the face of adversity. And so these include some of the positive experiences that I mentioned earlier, supportive adult relationships that I keep mentioning because they're so important, and then providing opportunities to build healthy self-coping and regulation skills. And so it's really important that we're helping children during this time build those healthy coping and self-regulation skills and providing the positive childhood experiences that we know are so important. So that when traumatic events like this happen, like a global pandemic or children and adults actually have the tools and abilities to weather life storms. And I'll also say, and Jacob alluded to this earlier, is that it's really never too late to build resilience and healthy coping skills and well-being. These are skills. We know they're learned behaviors, and they can improve over time. And you can improve them even at my age of nearly 50, right? And so, and that's by engaging in healthy activities like exercise and mindfulness. So we know that it's incredibly important, and we can participate in those activities on a regular basis to build those skills.
Yeah, so that just reminds me of kind of of something that I really believe is important, is that like when it comes to children, parents need to learn emotional intelligence. They need to learn how to deal with their own mental wellness and learn coping skills and all of those things, and then teach them to their kids. One of the things we do in my family is like every night we spend about 15 minutes together with parents and kids, and we basically just talk about things, and I use it as kind of like an emotional intelligence instruction hour, or at least 15 minutes of it, and talk to them about like, how do you do different things. And it was kind of funny because the other night one of my kids was texting while we were doing this, and I'm like, what are you doing? Like, why are you texting? We're trying to have this, it's engaging in discussion. He says, oh, I'm just trying to teach one of my friends how to have better self-esteem. I'm like, well, tell me what you wrote. And he read off what he wrote, and I'm like, well, that's pretty good. That's what I would have said. So go ahead and continue with that. And so I just think, again, I have an advantage as a therapist, but it's just so important for us to learn how to be mentally well as much as we can, and then to share that with children so that they build that internal architecture to be able to use those skills when they need them.
Yeah, and then in Iowa specifically, how is the state equipped to handle, or perhaps not equipped to handle, some of these emerging health needs as a result of all the events of this year?
Well, as I mentioned earlier, we have some challenges. Part of the challenge is the way our system is structured and funded. It's historically, mental health and disability services were always provided through the counties. And for a long time, it was the 99 counties just deciding on their own what to do. And some did a lot and did very well, and others not so much. So that is improved now with having 14 regions, because they are planning and collaborating and working together more. But still, the basis for the funding is the property tax levy, which is frozen at 1996 levels. So Polk County, for example, has not been able to raise their levy for 5 years, while their population continues to grow. Dallas County, another growing county, Lynn, Johnson, Scott, those metro counties, which tend to be more service, of course, have more services, also have growing populations, but they can't raise more money to pay for more services because they're frozen, they're stuck. So legislators have done a good job in Iowa over the last 2 years passing these policy bills to put into law requirements for more robust services, which are mostly going to be provided by private providers. But the funding has to be there, and that's both through the regions, which are really the ones that are charged with getting them started and off the ground, and also Medicaid. Medicaid funds 3/4 of all mental health services in the state. And so we have to have adequate reimbursement for providers for them to actually do the services. And one example of that is ACT teams. That's assertive community treatment. It's an evidence-based practice. It's a multidisciplinary team headed by a psychiatrist that provides 24/7 services for people to be able, who have usually high and complex needs, to be able to stay in their communities. It's a community-based service. We set out in the complex needs group to have a goal of doubling the number of ACT teams in Iowa from 11 to 22. And it has not grown at all because Medicaid will not pay the total, even the cost of providing the service. Most providers lose a significant amount of money on their ACT teams. So a few of them have actually dropped it, and we haven't gotten any new ones established. That's a problem.
Speaking at it from a little bit of a different angle too, as I think in a way that our state's not as well equipped for the future as we need to be, but I think we're in the same boat as a lot of different states. Is there has to be a better way of doing this. There has to be a better way to address people's mental health needs on a more global scale. I feel like for the last 20 years, I've been trying to put out mental health fires, and it's difficult, and it seems like those fires are just getting bigger over time. One of the things that I'm personally committed to is trying to find innovative ways to improve mental health on a more global scale. And I frankly don't know what the answer to that is. If anybody on this panel ever wants to help me out with that, I'm all ears and totally open to opportunities. But we need to figure out something better and to be able to supersede the situation in a way that will allow us to have a bigger impact. And then we can see a decrease in the dis-ease that we're experiencing if we can figure out how to overcome the limitations of our current system.
And Jennifer, is there anything that you're seeing from, more of a national perspective that could be a solution for Iowa?
I think I'm with Jacob. I think there are a lot of states that are experiencing the same thing. I know I'm based here in Wisconsin, and several years ago, the then governor, created the Office of Children's Mental Health at a cabinet level to really look at how do we improve our mental health system for children in particular. And I know Peggy's mentioned that as well. I think we have a very frayed mental health system, if you could even call it a system, right? And so I think we absolutely have to. I think it's imperative and almost critical and urgent that we think about solutions and innovative solutions to addressing the mental health issues in our country. As Jacob mentioned, I think it's only going to get worse. We know that based on sort of the collective impact of all the issues that folks are facing today. And so it's almost like a desperate situation, I think, right? And so I'm with Jacob. I think there are a number of folks nationally that are talking about this well-being trust is funding a lot of things around mental health, and I think collectively we all have to come together and figure out those innovative solutions and fund them, right? And we need financial support to improve the mental health system in this country.
Right, and absolutely, and philanthropy is never going to fill that void, right? It needs to be government funding for services. Mental health is not a lesser than need. It is primary to a person's well-being, because if they don't have good mental health, they are probably not going to take care of their physical health, which is why we see a lot of co-occurring conditions. People with serious mental illness die on average 28 years sooner than the rest of us. And that's not because of suicide. It's because they smoke. They have a lot of serious illnesses such as cancer and COPD and others that are not properly taken care of. So mental health is public health, and we need to treat it like that, and we need to fund it like that. Unfortunately, Iowa is the only state in the nation that relies on the property tax to fund their mental health and disability service. So we are alone in that distinction. When I was on the children's work group, we looked at Wisconsin and Minnesota as models of how to do children's mental health, because Wisconsin has a really good centralized system with metrics and measurement and data, which we don't have any of that in Iowa. And Minnesota has a very robust school-based system where they have embedded therapists, family therapists, help for kids right in the schools and the school system. So there's a lot that we could learn from other states. There's a lot of best practices that are happening. We just have to have the political will and the funding to make them happen.
Marissa, if I may, I think, I know that you wanted us to think about the question around the public policy standpoint, and I think Peggy just sort of led us right into that conversation. And so I just want to add a couple of things here around that question. And I know you were interested specifically in Iowa, but I think as goes the Midwest, as goes the country, right? So I think it's really important that we use and public policy makers and decision makers and advocates that we use this pandemic and economic crisis as a real opportunity to change the way that our systems are serving children and families and communities, and especially communities of color. And I mentioned this earlier, and Peggy alluded to it as well. Many state and federal regulations have been halted or temporarily changed because of the pandemic. And so the use of telehealth, right, being one of them. And so instead of going back to the old way, let's really think about how we can do these things differently, and make sure we continue the things that are good because they help us, and they help us help people be better and healthy. I think we need to invest in prevention, not just in Iowa, but across the country, so that communities who are experiencing a significant amount of trauma and stress are better able to handle any other pandemics or disasters that come at them. And we know that this is only the beginning. And if we're going to focus on reducing inequities in physical and mental health outcomes, we really need to focus on preventing and mitigating ACEs, right? And addressing the daily stressors that people are facing, even more so now in their lives and in their communities. I also have to say that it's absolutely critical that we address inequities and systemic racism. ACEs are way more common among people of color. These are compounded when they are experiencing the constant stress of subtle and explicit discrimination. And it creates this greater risk for chronic disease and mental health issues, which is why communities of color are being so hard hit by COVID. I think we also should invest in messaging and communications to reduce the stigma related to mental health and seeking out help. We need to start normalizing our mental wellness. And despite just the significant prevalence that we know exists in terms of ACEs and the mental health challenges that people are facing now and struggling with, policymakers and families and community leaders and others can really create environments. We have a real opportunity to create environments where children can flourish and thrive. And so I will just say, I'm a huge proponent of the brain science research. We have so much knowledge right now about how the brain develops and how toxic stress alters the developing brain. What we know now can actually, it holds great promise in terms of improving the effectiveness of services to children, adults, families, and communities. And so I think that policymakers in particular, they really have unprecedented and unlimited avenues available to them to really use public and private resources more effectively. The research and the science is really clear. The case for infusing this knowledge into and throughout our systems is very compelling. And I think we need to make bold changes. I think the time is now, and I think we need to respond with urgency.
Yeah, thank you. Jacob, I don't know if you had anything as well, on the public policy front, that you think could happen to help?
I just say, I can be just brief on this, but I think there needs to be like an interesting mix of deregulation and regulation. Just using telehealth as an example, we have about 10 different major insurers that service our state. Each one of them has different rules about how telehealth can be delivered and under what circumstances and which formats, and how different, like the patient versus the provider. So many regulations that it's really difficult to keep track of. Even within the state, there's not a really good clear definition on parity in terms of payment. So half the time people don't know what's going to happen if they try to provide telehealth. They don't know whether they're doing it right. They don't know whether they're going to get paid for it. They don't know if they're breaking some law, because there's so many different players that have their own different ways of doing things that nobody can keep track of it. So it'd be nice in some ways if we could just simplify some processes and say, look, this is the standards, and to just decrease the regulation in the sense of like making it easier to have access to care. There's no reason why somebody cannot be in their home and receive a service. But as of a couple of years ago, that was the standards. You had to be in a originating site, doesn't all these different things about how you can and can't do it. When in reality, doing it from having a patient in the home and a therapist or a provider somewhere else, like it's just as effective as anything else that we're going to do. So in some ways, we need just to simplify the access piece of it, and then also kind of regulate things in a way that makes it more cohesive, or at least congruent among the different players in the field.
Thanks. And just as a reminder to everyone, I know we have less than 10 minutes left. So if you have any questions, feel free to submit them in the Huppert chat feature. See, we have an audience question. What is the best way to support people with mental health issues? And I know we had also discussed earlier, on the kind of a micro and macro level. We've already talked a bit from a macro standpoint, from a public policy standpoint, but what can people be doing for other individuals or, for their families?
Well, I'd be remiss if I didn't strongly recommend NAMI. We have a lot of resources available, and anyone can go to our website, namiiowa.org, check out what we have. We have classes like family to family and peer to peer, which are for loved ones and people with a diagnosis to learn about the illness and to learn how to live with resilience and wellness. We also have support groups that are available, now more virtual than in person, but they are offered across the state. And those can be accessed through our state office if anyone is interested in that. We also have presentations that help educate the public about mental illness in our own voice, which is the person telling their own story. We have a program called Ending the Silence, which is specifically for middle and high school kids, as well as versions for educators and parents. Those are all free. All NAMI programs and support groups and presentations are free. And then finally, we have a thing called Provider, which is either a 4-hour seminar or a 15-hour class for clinicians, whether it's family doctors or social workers or teachers, people who work in care centers, a huge variety of people who could benefit from learning about the collaborative model of care and how to best serve and help take care of people with serious mental illness and to deal with their loved ones.
Yeah, I think that there's what NAMI does is phenomenal and extends way beyond what I typically tell people in kind of a normal situation. A lot of times I'll just tell people, like, basically whatever illness or whatever mental health issue they're struggling with, just replace it with cancer. Mm-hmm. And then do the same thing you would do if that was the case. With if somebody struggles from a physical illness, we support them, we're patient, we're compassionate. If somebody has a mental illness, we recoil, we decrease our engagement, and we stigmatize. Just replace whatever it is they're experiencing with some kind of physical illness that you feel super comfortable caring for, and that'll help you to know what to do. It makes it a lot easier when you kind of just realize that physical health, and we've been trained to deal with that for our entire lives. If you just realize that they're the same thing, it's a physical health problem, even if it's in the mind, then it makes it a lot easier to know how to care for people.
So true. We actually have an online support group called the Casserole Club, and it was founded by a mom who has a child with several serious emotional disorders, and she said, if your kid is diagnosed with cancer, as an example, or he breaks his leg, or something else like physical happens to him, people are showing up on your doorstep with casseroles. They're there to help you in a tangible way. But if your kid is diagnosed with a serious emotional disorder, they tend to shy away from you. They don't talk to you. They avoid you, and just when you need help and support the most. So there's another program I want to recommend, and it's called Make It Okay, and that is being provided through the Healthiest States Initiative. You can Google Make It Okay and find out more about it, but that is a hour-long program that is specifically formulated for workplaces. And it's to get people talking about mental health, mental illness, and understanding how they can support each other.
And I would just add a couple other things. Obviously, I think that's awesome, Jacob, that you use that analogy, because it's so right. I would just say, we know, in fact, a recent CDC survey, almost 41% of US adults reported they were struggling with mental health issues or substance use. So we are in unprecedented times. I know that word gets thrown around a lot, but it's true. And it's having a tremendous effect on all of us, both physically and mentally. And so I would say my piece of advice is it's incredibly important to take time for yourself when you can. So if you're healthy and well, you'll be better able to take care of your family and your kids. And there's certainly a ton of things out there that you can do to take care of yourself. We know mindfulness is very useful, and staying connected virtually to family and friends, and getting outside in nature, but being safe. But I will add, I think this point Jacob raised earlier, that it's really important for parents to model this healthy coping behavior, and he said he does it with his kids. And it's important for parents to experience who are experiencing mental health issues, to be honest with their children in age-appropriate ways, because they pick it up. They pick it up in verbal and nonverbal ways, and it's important for them to know that it's not their fault and that it's okay, that mental health issues and mental wellness is incredibly important. So I would just add those few things.
Awesome. Thanks. And yeah, we actually had an audience question on, what does it take to end the stigma, and everyone kind of, touched on that already. So thanks for that. And briefly, I know we only have about 2 more minutes, but another audience question is, what do you think would need to happen to increase the funding for school counselors? Someone wants to touch on that briefly.
Well, we do now, as I said, have a children's mental health system, at least in its infancy. And certainly K-12 schools are a huge part of that. The start of it was to give some money to the area education agencies to provide training to school personnel. And they're primarily using the Youth Mental Health First Aid, which is an 8-hour class that they're offering to a lot of schools. I think the pandemic, again, has put a big crimp in that, but they were doing it, and it can be done virtually. What we think is all school personnel should receive some training, bus drivers, office people, but then there are school people, guidance counselors don't receive any kind of special training. So there's a lot of training that could happen that would be helpful on how to, on evidence-based practices, a lot of the stuff that Jennifer was talking about, how to effectively deal with kids in a school setting, and how to see the signs that they need more help. That is not being done, and it's more than 8 hours. So just getting more guidance counselors is not the only solution. Right now they're spread very thin, and for the most part they're really not counseling. They're they're doing things like career advice and other things. So there needs to be a lot more help for schools, because what we heard loud and clear is teachers are just overwhelmed. They see it every day in their classrooms or now online, but most of them are not trained and really don't know what to do.
Yeah, and just briefly, I think public-private partnerships can help. We've been able to place a therapist in schools, like every school in about 6 districts at this point. So we're serving about 30 plus schools by having a partnership with the school, where we essentially move to where we support them in their mental health efforts in that school system. And they would not be able to afford it on their own, and we wouldn't be able to have the access that we do without that partnership. So I think there's some mutually beneficial arrangements that can be made too. I think that's worth exploring.
Agree.
All right, and before I wrap things up, one last question. Where can everyone find a list of the free resources to help with mental health?
Well, as I said, NAMIiowa.org, our website, we have a lot of resources on there. And if there's something that you can't find, the number for our office is on there, but I'll also give it to you. It's 515-274-0510. And but go to our website, NAMIiowa.org. And if you have a question that is not answered on there, let us know and we'll try to help.
All right, wonderful. Well, thank you all for attending, and special thanks to our panelists. Please stick around the conference. We have sessions, more sessions this afternoon in the healthcare track. Up next is Reimagining the Future of Healthcare at 3:15 p.m., followed by the future of prescription drug prices after that. And of course, more sessions tomorrow morning. So yeah, thank you all again for joining us, and hope you all enjoy the rest of the conference.